Gwen and Michelle, thank you so much for organizing this talk and for that kind introduction as well. I'm very delighted to be here. It's nice to look out and to see a capacity audience. A few of you are my patients, and thank you for coming. The title of my talk is Macular Degeneration, its causes, its symptoms, and its treatment. I want to start out by, for some of you are here as patients of mine or of others, some are here as family members of people who have this condition, and I want to start out by expressing my partnership with you in this against this disease, macular degeneration. I want you to be aware that I understand the impact that it has on life, and how important vision is primarily why I chose to be an ophthalmologist and a retina specialist, is because I understand the importance of this. And so I know this could be hard for a lot of you. Some people have family members who suffer from this, and you might have some anxiety about what your prospects are of developing this condition, and that's partly why you're here as well. So I want you to know that I understand. My family and I are relatively new here in Dubuque. We've been in Dubuque for a year and a half, and I know quite a few people, but part of what this is as well, these series of talks, is to introduce to get to know each other, and it's sort of an introduction to the community. So I'll start out by telling you who I am and what I've done, where I've been, and then we'll go into the talk itself about what macular degeneration is in layman's terms that can be understood. So my name is Stephen Odaibo. I am a retina specialist, and I would add that I am the only retina specialist in the world with graduate degrees in mathematics and computer science. That's of interest in and of itself, but not something I'll be talking about in this talk. Hopefully I'll have another opportunity to talk about some of the research that we're doing using mathematics and computing to try to improve the diagnostic modalities for conditions such as macular degeneration. I practice here at the Medical Associates Clinic in Dubuque. And along the lines of research, as I stated, I co-founded a company called RETINA-AI, which uses artificial intelligence methods to improve retina care. I was born in Nigeria, and I completed high school there in 1997. And then I came to the United States. I got my bachelor's degree in mathematics from the University of Alabama at Birmingham in 2001. And then my master's degree at the same institution in 2002. And then I proceeded on to Duke University for medical school. While there, I worked in the Nobel Prize winning lab of Robert J. Lefkowitz. That was from 2004 to 2006. And then I went on to get a master's degree in computer science there at Duke, which I obtained in 2009. Returned to the medical school in 2000 and got my MD degree in 2010. The basketball at Duke was so good that I had to stay on. So I stayed at Duke for my intern year in internal medicine, which I completed in 2011. And then I moved on to Washington, D.C., Howard University, for a residency in ophthalmology, which I completed in 2014. And from there onwards, I got a taste for football, and I wanted a place with some good football. So University of Michigan Ann Arbor was where that was. And I completed my fellowship there in medical retina in 2015. So as I stated, this talk is about macular degeneration. And the big question here is, what is macular degeneration? In this talk, I'm going to talk in layman's terms. I'm going to use analogies that would help you leave here with an understanding of what it is. I will avoid medical jargon and big words. They'll slip in every now and then. But certainly, this is going to be interactive. And so let me know if there's anything in here that you don't understand or that you would need clarification on. So we will be answering these questions in this order. What is macular degeneration? How would you know if you have it? That is, what are the symptoms? How will your doctor check for it? What are the types of macular degeneration? What can you do to prevent it? And how is it treated? So to begin answering these questions, we have to start out by getting an understanding of what the eye is and what its different structures are. So here's a picture of the eye, and it's labeled. In the front part there, you have the cornea, which is the transparent part of your eye. Right behind it is the lens, and that whole space in the back is called the posterior segment of the eye. And over there, lining that area, is the retina. The optic nerve is the cable that then takes signals and goes out to the brain. So as you look out on any visual scene, light, photons travel through the cornea, through the pupil, and through that lens, and strike the retina. The retina is like a circuit with different layers of connection, and the signal begins to propagate, goes into the optic nerve, goes into the brain, and that's how we're able to see. So the retina is a very important piece of tissue, and that's where macular degeneration happens. We'll see that shortly. Right in the center of the image, what you have there is called the fovea. That's your 20/20 vision. That's where all the action happens, okay? That's prime real estate. Somehow macular degeneration knows that and tends to occur there, and that's why it can be such a debilitating condition that affects central vision. You can also see blood vessels as they emanate outward from the optic disc to supply the various areas of the retina. As I stated, the retina sends signals to the brain. We look out on a visual scene, photons of light travel through the cornea, the pupil, the lens, and strike the retina and begin a signal that's transduced and propagated and moves through the optic nerve all the way to the back here where you have the brain. Perception occurs, and that is how we see. So if anything interferes with the retina, especially in that center where it's most important, that fovea, it can cause vision loss. So now that we know the structure of the eye, we know what the retina is and what it does, the question then is, so what is this macular degeneration? Well, macular degeneration is a disease that can affect the retina as we get older. The more technical term that some of you might be familiar with is age-related macular degeneration. In this visual illustration, what you see is that at the top there you have an image of the eye, what we refer to as the posterior pole, that prime real estate that I told you is called the fovea, where the 20/20 vision is. And in the normal case, in the top left panel, you see what the fovea looks like. To the right of that is the image that one would visualize where you're looking out at that particular visual scene. Now in the bottom row, on the left, what you see is macular degeneration. That's causing problems. That's not normal. There's blood underneath the retina. Fancy word for that, subretinal hemorrhage. You have that region that's patchy and is lighter colored. That's called atrophy, thinning of the retina. These things cause visual distortion and blindness. And then the very hallmark of macular degeneration, which we'll see more in the coming slides, those little yellow deposits, waste products, if you will, that are called drusen. For this particular patient, the image on the right lower corner is what they observe. You see, there's a dark spot in the middle. So this person's central vision has become compromised from macular degeneration. So in this slide here, on the left, that's a normal retina again. We see the optic nerve, we see the fovea, the blood vessels, everything looks normal. But on the right, that's an eye with macular degeneration. What makes it macular degeneration are these yellow dots that are all over. They're not normal. They're called drusen. And when a person has them, we say the person has macular degeneration. Now, sort of a nuance that I would add is that macular degeneration really is a bilateral condition. Bilateral is a big word for both eyes. It typically affects both eyes, although not to the same extent necessarily. And we say it can be asymmetric, which means one eye can have it a lot worse than the other. And we'll see examples of that shortly. But if one has macular degeneration, you have it in both eyes. So what are the statistics? Who gets macular degeneration? When do they get it? And how does that change over time? So this is data from the United States, 2010 data from the NIH, which is the National Institutes of Health in Bethesda, Maryland. So for people in the United States, these are prevalence rates for age-related macular degeneration. Simply put, how many people in the United States have macular degeneration? And one thing that strikes you right away is that, so on the x-axis is age, right? That's age. So 50 to 54 is the first batch of columns of bars. 55 to 59 is the next, and so on. And so as you go from the left to the right at the bottom, it means people are getting older. The y-axis tells you what percentage of the U.S. population has macular degeneration. So the first thing that jumps out at you right away is that the older we get, the more likely we are to have macular degeneration. That's a big part of the story of the epidemiology, of the statistics. Now, the color codes to your right, at the top in blue, color-coded blue, are Caucasians, whites. Color-coded in red are blacks or African Americans. Color-coded in green are Hispanics, Latinos, and in purple are other races. The first thing that jumps out at you is that Caucasians are overwhelmingly more likely to have macular degeneration than others are. And this difference becomes even more pronounced with age. So in summary of the statistics, macular degeneration becomes increasingly likely as we get older, and macular degeneration is more common in people of European ancestry. And that's quite interesting, because in the United States, ancestry is, a lot of people are of mixed ancestry, and one certain thing is that people of European ancestry are more likely to get this. But interestingly, people of mixed ancestry are significantly less likely to have macular degeneration. Yes, macular degeneration does run in families. That's a question that I get quite often is, if I get it, or my siblings or my children likely to have it? The answer is yes, they are more likely to have it than people than the children or siblings of people who do not have it. But it's a little bit complicated. So yes, if you have this condition, certainly your children and siblings should be checked for it, and their eye care providers should be informed that they have a first-degree relative with the condition. However, though, it doesn't mean that if you have macular degeneration, your close relatives would also have it. It does not mean that. They may not. So what are the symptoms? How would you know if you have macular degeneration? What may you see if you have this condition, or what would your vision look like? One of the more prominent symptomatic features of macular degeneration is that things that you're trying to look at right in the center of your vision would appear blurred. So this is on the left side. Imagine this is somebody looking out at their grandchildren, and they want to see their faces and see them smile. Unfortunately, what they see is a distortion and a dark gray spot that covers their face, which is exactly what they would want to see. What they want to see is their face, but they can't. However, it often affects the periphery less so. So things that you're not so interested in seeing are typically less affected. That's not universally true, but is generally the way it goes. So that's one symptom that one might see if you have macular. Not everybody would see that. Here's another illustration of that very thing. The fancy word for this is a central scotoma. But what it is basically that because that real estate I told you about earlier, that 20/20 vision called the fovea, is often the place where macular degeneration likes to strike. So here on the left side, you see this person is looking out over a lake through some trees at a house that's nestled between a couple of trees there. On the right, if the same person had macular degeneration, they're able to see everything in the periphery of the object of interest. What they really want to see is that house, but it's obscured. What city is this? Yes, San Francisco. So here on the left side, you look out and you see the streetcar and the buildings and the hilliness that's so characteristic of San Fran. And that's in a person with normal vision, what they would see. However, on the right, what we see there is the road is a little wavy, as are the buildings. We know San Francisco is earthquake prone, but this is not an earthquake. This is one of the manifestations of macular degeneration. It's a fancy word for this is metamorphopsia, which simply means that things that should be straight are curvy instead. So this is one of the things you can see if you have macular degeneration. Another symptom is blurry vision. Now, blurry vision, there are 1,000 things in the eye that can cause blurry vision. Anything from cataracts to diabetes to even dry eye and so on. And macular degeneration is one of those things. Again, the picture on the left is the normal view, and on the right is things are blurred and obscured. Someone with macular could have this symptom. Again, that characteristic dark spot that we see in macular degeneration resurfaces here in this illustration. On the left is a normal view. On the right, you can imagine how debilitating and disturbing macular degeneration can be. This is a person who is driving, and the very thing they want to see is the road ahead of them. But in this case, this person can sort of make out everything else but the very thing that they need to see. So a lot of you have this called the Amsler Grid, and everyone with macular degeneration should own one of these. It's basically a paper card with lines drawn into a grid form, and there's a central dot in the middle. On the left, that's what a person with normal vision would see. However, on the right, you see a combination of all the different symptoms that someone with macular degeneration may have. First, the central dot and its surrounding neighborhood is more blurry. The lines are not straight right about the center there. They're warped. And furthermore, there's a central darkening of the surrounding neighborhood of the target. So this grid, as we'll see later on, is used to monitor progression or changes in macular degeneration. And as the symptoms get worse, this grid can help one identify that and seek immediate care from their retina specialist. Okay, so we went over the symptoms, what you would see if you had macular degeneration, or some other things you could see, rather. Now, how would your doctor know that you have it? What things are checked for? That's also important to have a sense of, okay? So basically, it comes down to two things, an eye exam and eye pictures. Those are the two most important tools in the physician's armamentarium, or the care provider's armamentarium, to monitor for macular degeneration. So we've seen this picture. On the left, that's a normal retina, okay? While on the right, you see the little yellow dots. Each one of these dots, there's so many of them. They're called drusen, and you can think of these as waste products in some sense. As when we're younger and everything is working just right, the retina has a way of clearing things that form and build up underneath it and taking care of it. And so everything looks good. But as we get older, the mechanisms somehow begin to break down for clearing the buildup that forms. And instead, that buildup begins to cause breakdown underneath the retina and can cause visual problems, vision loss, bleeding, and the like. So in addition to the exam, which we just saw, and photographs of the eye, there are other types of photographs that are taken. And some of you in the room would have had a test like this already, where one injects a dye. This is called fluorescein angiography. One injects a dye into the vein, and then the dye flows to the eye and fills the blood vessels of the eye. And pictures are taken in sequence over time as the dye fills up. And the patterns that the dye shows can tell one something about what eye diseases a person has. In particular, it can say whether macular degeneration is in one stage or the other. And not to jump too much ahead of myself, we'll soon be talking about dry and wet. And this is one of the ways that the different types of macular degeneration can be sorted out, especially in cases that are not clear-cut. So this is a picture of a fluorescein angiogram, and what you can see is those blood vessels they've lit up. This looks like some kind of a galactic constellation, the Crab Nebula or something to that effect. And this is just a normal retina that's filled up, but with its veins, with blood and the arteries as well. Here in the picture on the left, again, is a normal retina. On the right, there's macular degeneration, and it's in a particular stage that's concerning, called a wet macular degeneration, which we'll talk more about shortly. Here's another picture of the fluorescein angiogram, and on the leftmost picture, what one sees there is an advanced stage of macular degeneration, which we call wet macular degeneration. The fancy term for that is exudative macular. And in this particular patient, there's blood under their retina, and that's one of the reasons why it's wet. And that can cause rapid loss of vision, can form a scar tissue under the vision, and can lead to central vision blindness. That's one of the primary mechanisms by which people go blind from macular degeneration. There's also loss of the pigment cells underneath the retina. You can see all of that by just looking at the picture. The picture in the center is after the dye has been injected. In the earlier phases, one is able to see that the blood is blocking the what we call fluorescence. You can think of that as a reflection of some sort, and that's why you have the dark areas there. In the central areas, you have it's brighter, so it's what we call hyperfluorescent in a particular way that tells you that there are bad blood vessels growing underneath that retina and that this patient needs treatment. Here's another picture with a similar type of a profile. Is a person with wet macular degeneration. Another picture that we use a lot is called optical coherence tomography. I rely very heavily on this type of picture to make my clinical decisions in the clinic regarding what the treatment plan is for a patient with macular degeneration and for doing periodic monitoring. A lot of you have seen these pictures in the clinic, in my clinic, or wherever else you get your care, and it's often it may often be the case that the physician runs into the room, flashes a picture up on the wall, mumbles a few things, and runs out of the room, and then you're getting a shot in your eye. Hopefully, it's not that fast, but this is an opportunity to go over the anatomy with you very carefully, so that you have an understanding of what those pictures are and what types of things you should be looking for. So the picture on the left is that's what your eye looks like. That's what your retina looks like. It's like if you pull out your smartphone and take a picture, you get a very close representation of the actual thing. So this is not a reconstructed image. Your retina looks like that's somebody's retina, and it's literally a picture of the retina. Now, the green arrow traverses through the center, that fovea, that central dot. You see the central dot there actually dips. Now, if you look on the right side of the picture, you see like a valley. You see that valley right in the center. That dip is the center. And this is completely normal anatomy. That's the way it should look like. So on the picture on your right, as you go from left to right, you notice that the very surface has a thickening which gradually narrows. And that's because what we call the nerve fiber layer, near the optic nerve. Closest to the optic nerve, you have the thickest white band, and it begins to thin as you go along the arrow, the green arrow. The green arrow was drawn in by me. It's not actually in the person's eye. Now, not that you thought that, but it's important to point that out. And as you start to go, you reach the center, and you get a little dip right in the center, and it continues to progress. So this is completely normal retina. This is what it should look like. I've gotten the question quite a bit about what the dip is and whether it's normal. It is absolutely normal. The absence of the dip would be abnormal. So that's a normal patient, a normal person. Now, we have two columns here, one on the left and one on the right. The one on the left is completely normal. Again, you see the dip, you see the optic nerve. At the bottom, you see the O.C.T image. Think of it as an X-ray. It's a slice right down the center, and you flip it on its end, and so you're looking at the full thickness of the retina. And you have the dip right in the middle. So this is like a slice right through the center of the retina and flip it on its end, and you can see all the layers. The human eye cannot see this, but this picture, which is very useful for us, can see this. On the right, it's macular degeneration. You see all the yellow dots of waste products that are not being cleared. And when you take that slice right down the middle and flip it on its end, that's called the O.C.T image. You see that there are these bumps, these lumpy bumps all through the bottom. That is a sign of macular degeneration. In this case, it's dry macular, which we're going to talk about in the coming slide. But it's a problem, and it can lead to wet. And even if it doesn't lead to wet, it can still, by itself, lead to vision loss. And so this patient needs to be monitored very closely. And whoever this is needs to use their Amsler Grid every day. These are two pictures of the O.C.T. You can think of it again as an X-ray. It's non-ionizing radiation. X-ray is an analogy that's not precise in this case, okay? Because you don't get radiation. It doesn't increase your risk of cancer. It's just optical interferometry. But as I said, this talk is, I don't want to use any big words, and so I'm going to use some analogies that are not necessarily precise, but they get the idea across. So on the left, again, you see the picture of the retina, normal. On the right, macular degeneration. And this is a bad case because there's fluid, there's leakage underneath the retina, right above that white line. The dark bands there are problematic because they're what we call leakage or subretinal fluid. That's fluid under the retina. It's bad. It can lead to problems, can lead to scar tissue, can lead to damage of the sensors underneath there, and can ultimately lead to blindness. So this is a patient who would need to be treated with injections in their eyes, which is currently the state of the art at the time of this presentation. So I've already alluded multiple times now to the notion of wet versus dry, and you've probably already gotten a sense that wet's probably worse than dry. Well, that's so let's go into that and talk a little more about that. So there are two types, very simply put. Now I say very simply, there's dry macular degeneration, and then there's wet macular degeneration. Okay, that's the simplest categorization of the disease. So in dry macular degeneration, you can think of it that there's no bleeding under or inside the retina, and there's no leakage. However, be aware that it can also result in vision loss and blindness, but typically it does so much more slowly than the wet form. And at the time of this presentation, there are no proven treatments for the dry form of macular degeneration. There's a lot of research being done, and a lot of possible pathways are being investigated that can slow the process of dry macular, but there's none yet that has been proven to work. So dry macular degeneration, again, I have two columns up here. On the left side, you see lots of drusen. Drusen, again, are those yellow dots that are waste products that form underneath the retina that make macular degeneration. And you see of that same patient, there's the O.C.T, think of which, again, we're calling X-ray, if you will. It's not really an X-ray. But it's like an X-ray. It's a slice right through the retina, and it's a picture slice. Imagine if you can look inside of the retina and flip it on its end. That's what you see. So we see the drusen. On the right side, right dead center, that's the person with also dry macular. In both cases, there's no leakage, there's no blood under the retina, there's no fluid inside of the retina. They look very different. So macular degeneration can show up in many different types of ways. On the picture on the right, as you look at the slice right through it, you see the center, that real estate, the most precious part of your vision, which we call the fovea. It's been severely damaged in this patient with macular degeneration, and it's dry macular. So the take-home point is that, yes, wet macular is probably worse, but dry macular in certain cases can certainly cause blindness as well. So now, what's wet macular degeneration? It's defined by leakage of fluid from beneath the retina. So the retina should not be logged with fluid. Blood vessels should not grow underneath it. It shouldn't bleed. But in macular degeneration, there is a breakdown of the barrier that separates the piping that's under the network of pipes that should be always below the retina, and just supplying it with oxygen and nutrients through well-behaved diffusion. That process, the barrier breaks down, and then problems begin to occur. There can be bleeding underneath the retina. Whenever this happens, there can be rapid vision loss if it's untreated. So we think of this as an urgent condition that requires close monitoring and requires intervention. So these can be treated with eye injections, and we'll talk more and see more about that shortly. So this wet macular, again, you see the arrows that I've drawn in. There's leakage of fluid under the retina. And these are two pictures, two O.C.T images with with subretinal fluid. Note that there's this white line. The white line is called the retinal pigment epithelium. That's its fancy name. The dark areas underneath it are less problematic, actually. They're more structural changes that can resolve. But what we really do not want to see, and what really can cause problems, is the dark bands above that white band. That's the subretinal space, and that's where the most sensitive sensors live, what we call photoreceptors. And so we want that to be free of the fluid and of the agents of inflammation and fibrosis and the like. Big words, basically things that can cause scar tissue and that can cause blindness. So again, a wet macular degeneration has other manifestations. In the picture, which is a fundus photograph, the picture on your left, you see that there's blood. That yellow arrow orange arrow points to the center area. Again, this is the most precious part of your vision. This is the real estate, the prime real estate, called the fovea. And in this patient, there's blood underneath it, and that's a problem. In macular degeneration, there can also be leakage of fluid into the retina, right into its substance. And in the picture on your right, what you see there is there's fluid that has leaked into the retina. That's problematic and can lead to vision loss as well. So again, the question is dry macular then better than wet macular? Well, it depends. It's a little bit complex. Yes, in most cases, dry is better, but not always. For example, this is a patient here with dry macular degeneration, but has this huge, obviously abnormal thin right in the center, and that's called geographic atrophy, and it's problematic. This can lead to blindness. This patient is essentially blind from this. And in the O.C.T. image, you see that there's significant structural damage. The bottom layer here is called the photoreceptor layer, and it's completely gone, and that's problematic. So dry macular degeneration can also lead to blindness, and some people might wonder, why does one person get injections and another does not? As I said, the injections currently are for wet macular, and don't have a role in the dry form of the condition. This problem that this patient has here is called geographic atrophy. That's the fancy word, and it's really just a severe thinning in the retina, which we can see with macular degeneration. So again, two people with dry macular degeneration. In the pictures on the left column, this patient can have very decent vision. He may even have 20/20 vision, possibly. While on the right, this patient has poor vision, which can be anywhere from very poor to blind. So we've seen wet, we've seen dry, we've seen various features. And I made a point to emphasize that the dry-wet categorization is, though it's very effective and useful, it is simplistic. In reality, just like toppings on a pizza, there can be various combinations of the pathological features in macular degeneration, and they can all be happening in the same person, in the same eye. Like looking at this picture here, there's the top arrow points to blood underneath the retina. That's what we call subretinal hemorrhage. That means this person has wet macular degeneration and will benefit from these injections, or could. In the middle arrow, you see there's a large region there of geographic atrophy, which means that the pigment layer, the dark layer under the retina that supplies it with its nutrients, is gone. It's thinned out, or in some cases just torn off. And you also see lots of drusen, the large kind of drusen in this case that this patient has that makes them have macular degeneration. So it can be complicated, and it can be certainly a mixed picture. And currently we say macular degeneration, but the reality is that there are multiple different types, multiple different phenotypes, multiple different combinations in the genetic code that makes some act differently from others. This is something we are currently trying to understand better, and it's not the topic of this talk. This is my talk. This talk is a community talk. I'm getting to know everyone after a year and a half here, and but we're doing research using artificial intelligence techniques to learn a little bit more about what the different features of these diseases are. And hopefully I'll get a chance to talk some more about that later at another time. So what can someone with macular degeneration do to prevent the worsening of the condition? Number one, sunglasses. It's called ultraviolet protection. Whenever you're in the sun, wear sunglasses. That's very important. Like I said, yes, macular degeneration is a genetic condition. It runs in families. But some people rightly would point out to me that, how come I have macular degeneration and my sibling does not? And part of that is just their genetic combination is indeed different from yours. It's similar, but it's different. But another part of that might mean that maybe, so here we live in an agrarian community, a society here in Iowa, and one might have spent a lot of time out on the farm, where decades and decades without wearing sunglasses, whereas another sibling might have had another type of job that kept them indoors, and that could very well be the difference. Number two, we talked about this grid. Very, very important. If you have macular degeneration, this takes a second out of your day. Close one eye, look at the central dot, and close the other eye, look at the central dot. Make sure there's been no change. I did a rough calculation, and this is going to cost you about 8 minutes every year. So it's very well worth your time to do. And the idea here is that for people with macular degeneration, if they see a concerning change, you call your doctor. Don't wait till your appointment 2 to 3 months later, or 4 months, in some cases 6 months. You go right in and get checked, because time is often of the essence. And then number three, these are certain vitamins that are called AREDS2 vitamins, which have been studied by the National Institutes of Health and have been shown to potentially have some benefit in certain types of macular degeneration patients. So it's not been shown to work in everybody with macular degeneration, and so it's ask your doctor whether you're a person who this would benefit. So people sometimes would even ask me, should my children start taking it? And I've even had somebody ask me whether their grandchildren should start to take this who were in kindergarten. And I said no. So don't take it. But they shouldn't take it if you've not been diagnosed with macular degeneration. There's no evidence that it helps you. There's no clear evidence that it hurts you either, but it could certainly hurt your wallet. But if you do have macular degeneration, what we call types 3 or 4, then you stand to benefit from this. So the treatment for wet macular degeneration is with eye injections. Quite a number of you in the room receive these injections. Of note, the injections have no role. They don't help with dry macular. So I've had some people who are losing vision and are understandably desperate for some intervention, some help, anything, and wonder why they're not getting shots, but their friend or neighbors are getting the shots. And it's often because of this, that if you have dry macular degeneration, the shots don't help. They're not known to help at this time. So here's a short video of me doing the injection, and for those whose family members get them or who have dry macular and wondered, what it's like, here we are. So it's a 2-minute video. I put on my mask. Again, everybody does these injections differently. And this is my technique that I'm showing here.
Because
That's Amanda Williams, one of my staff.
chances of endophthalmitis. Gloves as well.
I always use gloves.
Both of these accessories are not universally used by retina specialists, but I find that they make good sense.
And so we put a mask on our patient as well.
So my first step here is uncap.
That's the medicine.
Express any bubbles that are in there. I would also adjust to the volume that I would be injecting. In particular, 0.05 cc's.
There's essentially no room for error in the eye. So you have to get everything just exactly right.
And in this next step, I would insert an eyelid speculum, which also is not a universal accessory in this procedure, but I find it to be convenient and useful as well. Look down, sir. One under the upper eyelid, and look up. And straight ahead.
Okay.
Now I want you to look down to your left. Keep looking down and left.
That's some betadine.
Okay.
Decrease odds of infection.
3.5 millimeters from the locus.
We go at a specific location.
Here's the syringe here. Just hold still, sir.
That's the needle just went in. Injection is being done.
There. When you're done, I would here take that out. I immediately dispose of.
And that's the whole process.
Whether you're done.
So thank you so much. It's been a delight. Thanks for taking an evening out to come and listen to me. And this is my family. So that's my son, Daniel. He's essentially a Dubuquer. Though he was born in Ann Arbor, Michigan, he has spent most of his life, the last 18 months here in Dubuque. So this is all he knows. That's my wife, Lisa. She's a pediatrician. And we were out here. That's a picture in San Francisco. Up there, I was, I think, in somewhere in Iowa, Des Moines, Iowa, I think. So thank you very much again. And it's been a delight. I know a lot of people have questions. I'll stick around afterwards, and we'll talk some more. So just come up here and say hello. Thank you very much. And it's been